Coming up on At Issue, we've got a diverse panel of experts in the studio to talk about the Illinois budget crisis. See what they have to say on the heels of the State of the State address. That's next, so stay tuned. I'd like to thank you for joining us today on At Issue. I'm Fred Peralta, and today we're talking about the 800-pound gorilla in the room, or at least the State House, the Illinois budget crisis. Yesterday, Governor Quinn took the stage to give his State of the State address. And while he waited to the very last couple of minutes of his speech to discuss the matter, Quinn claimed we are at a critical juncture. The problem? The $97 billion and growing underfunded state pension program. Quinn stated, that brings us back to the toughest of issues, the public pension system, which left unreformed is squeezing out education, public safety, and other vital services to the tune of $17 million a day. And he called on state legislators who were listening to the address, hard is not impossible. Well, hard may not be impossible, but it certainly is hard. So hard that it's taken years to get into this mess, and most likely will take years to get out of it. With me today is an excellent panel of people who've been following this for years and will try to help us understand what exactly is the problem and how hard is hard. With me on my left is Dr. Alan Baharlou, Eastern Illinois University Professor Emeritus, and he does extensive work with the U of I Annuitants Association. Next to him is Dr. Alan McNitt, Eastern Illinois University Political Science Department, and Shane Rogers, an instructor, political science instructor at Lakeland College and a friend of our WEIU's. So, gentlemen, I guess to figure out how to fix the problem, we first need to understand how we got into this problem. Dr. Baharlou, how did this mess happen?
Since 1936, when Social Security passed, state and all employees had until 1940 to decide whether they want to go Social Security, defined benefit, or defined contribution for the retirement of employees. Illinois chose defined benefit instead of Social Security. Defined benefit, you keep the money here, and then you collect money from employees each month, and then the state's supposed to match that exact amount. For example, for universities, 8% employees each month, 8% university contribute.
So the state has been paying, the employees of the university, instead of paying in Social Security, has been paying 8% of their check to the state.
Automatically comes out of our salary each month.
And so that money is supposed to be there and collect interest and over the years grow, and when they retire,
That's correct. So since 1940, a state so-called quite often took pension holidays, not paying their contribution. Until 1969, EIU Vice President for University Administration, Bill Siegel, organized employees and retirees and went to the Illinois Constitution Convention 1970. Once more, give them the choice to choose Social Security, defined contribution like 401k, or if defined benefit, you have to guarantee it. They discussed it whole day, this Bill Siegel told me. Then at the end of the day, decide stay in defined benefit because money stay in the state, and they don't have to make contribution exactly each month. So they guarantee it. That was Article 13, Section 5 of Illinois Constitution.
So, I'm sorry, excuse me. Dr. McNitt, this money has been coming into the pension program. Where has it been going? Where is it?
Periodically, the state has financial problems. And when it has financial problems, one of the ways state governments borrow is rather than going on the market and borrowing money, what they do is they don't make payments to the state pension fund. So you skip payments to the state pension fund, or you pay less than the matching requirement. And of course, you always promise, of course, we'll make it up when times
so
are good.
So a lot of IOUs
but they don't.
Being posted.
Yeah, they post IOUs. And it's a system of self-borrowing. And because the obligations that the pension fund incurs don't have to be paid all at once. The $97 billion in obligations are not due immediately. They would only be due immediately if everybody who could retire retired all at once and collected everything they had, and then managed to live through some period of time in their retirement.
Correct me if I'm wrong, but that $97 billion figure isn't what's due today.
No.
It's what's due potentially 50 years down the road?
It's what's potentially due if everybody who can retire retires. Usually you have to fund a pension fund at least 70%. We are, however, funded at, what is it, Alan, some 40%?
Actually, right now we have 14% asset as far as considered. So in other words, within 16 years, SERS, which is the State University Retirement System, it manages all the 5 state pension systems. It has only 16 years. If a state does, because we don't have a state contribution, and because we don't have that, we don't have the money to draw interest. Actually, because of lack of that cooperation, we are about over 120 billion not having that fund. And so the SERS, which is managed all the, so they're going broke. But the governor got the impression like the pension has been taking money out of the budget. Pension has been contributing to Illinois budget. In other words, the money, instead of going to the pension, went to the school, to other services. In other words, he's working and he contributes to pension, pays the retirement pension. That's when we survive. That impression was not given. Like pension has been taking money out of the budget, instead of saying pension money has been staying in the state for other services. If we don't have the accurate data, we didn't want to say that Illinois, as you well know, is one of the 7 states in union has flat tax, in a flat property income tax. Is not progressive. In other words, whether you make 50,000 or 50 million, you pay the same rate. Out of the 7 states in the union, Illinois has the lowest flat tax. So it didn't say the problem is we don't have enough income or a fair income to manage our budget.
Now, Shane, when in 1970 the Illinois went through a constitutional convention and came up with a new constitution that did that help the situation or did that make it worse?
That's debatable in and of itself, exactly. A little bit of both.
Depending on your side. Yeah.
Right, because you put the element of obviously democracy into that and you're going to get a mess. But it helped it in a way that it made it an issue. I think, like Dr. Baharlou and Dr. McNitt had said, the fundamental mistake now we see what was staying with what they had put into the defined contribution program.
So what has this money been spent on? I mean...
Oh, everything.
Yeah.
It's been spent on roads, it's been spent on schools, it's been spent on law enforcement, it's been spent on salaries for members of the legislature.
Okay.
We've benefited in other ways, just not the way it was supposed to.
Illinois undertaxed.
So that's okay. That's a good question.
Undertaxed.
All the talk has been on the cutting side, and none of it's been on the revenue side.
For years, Illinois had the lowest tax of any state with an income tax.
Now,
even after the tax increase.
Now, you certainly wouldn't gather that from hearing.
Well, no one is going to say that to the public, and if I was running for office, I wouldn't say it either. But I'm not running for office, so I can tell you the truth. You had the lowest tax rate of any state with a income tax. After you raise the tax rate, we're only in the middle, which is one of the reasons we could raise taxes, because it put us about in the middle of tax rates. Now, had someone managed earlier to repay the money to the pension fund, we would not be having this discussion. They didn't repay it. I remember 20 years ago going to Springfield and talking to a member of the legislature about, well, my union wants to legislation that will repay the retirement fund. And he said, don't worry. Your retirement fund is guaranteed by the state constitution. We can borrow the money, and of course it will be repaid, which of course it never was. The state did eventually pass a bill to repay the pension system. The bill basically has an escalating repayment schedule. It's like a balloon mortgage, you know. And it was passed because most of the people who voted for it wouldn't be in office when the chickens came home to roost. And what has happened is we are right now at a point where the repayment schedule is biting into the state budget terribly. And you know, 70% or so of what goes into pensions now goes in only to pay back the arrears. In other words, if you didn't have the arrears, you pay 30% of the cost, current cost would go to pensions, and it would be highly sustainable. The plan, when it was passed, was bound to fail, and it is now failing. The plan is frankly creating difficulties, and one of the solutions to the difficulties is to extend the repayment schedule. It was way too little initially. It becomes way too large eventually, and you know, everyone else extends their repayment schedule, and one thing the state could do is to try and extend its repayment schedule, which would help.
Now,
what hasn't paid though, that is on the rating agencies. They said Illinois does not pay, meets its obligation. It's not, that's when the rating goes down, because Illinois has not paid its pension obligation. And if you can, it's not reliable to treat a citizen, how could we lend him money, lend this state money of other investors? So that is reason happened because Illinois hasn't paid that fund. And planned, Edgar had, as Andy said, by 2040 to have all of, they forgo that, they didn't meet the obligation. And so they extended that. And it's the most critical aspects because people living longer, and we when came in as an employee, we signed a contract, an agreement, a policy by law. It's not only pension, but it's also, so we manage our life, we set our life on that, counting on that pension, and our survivals, our families, is not only that money, it's ever widening circle, like a pool, a stone in the pool that ever, so it is getting effects in everything. People at retirees and so on, so it's a ever widening, and estate rating, estate reliability. Many of our faculty that we hire, the first thing they ask is retirement benefits. And many of them, the minute they find out the state, when I, as a department chair for 25 years, that was the first question. What is our retirement benefit? What's healthcare benefit? So I explained it to him, and when they signed the contract, they signed the contract on that base. So it's so fundamental. That
it's a fundamental promise that was made to citizens of Illinois that by law that we were going to do this. Now, are any of you familiar with the bill that's out there, Senate Bill 1, which Governor Quinn said was the best way out of this? What are the pros and cons of Senate Bill 1?
The Senate Bill is a combination of two. One that during the lame ducks did not pass. To reduce, only COLA would be based on only $25,000 salary. The maximum annual cost of living $750. Increase the payment 2% by current employees. That didn't go through because many of them said constitutionally. So the president of the Senate, Collerton, had another segment, and which passed it in the summer, recommended, didn't pass, to give employees and retirees a choice. Healthcare or no COLA. That's a choice. No healthcare. If you want healthcare, then you have to forego COLA. So he combined those two, and there's a policy in the Senate that, because the first one does not meet the constitutional, it's the unconstitutional changing. So this had, if it passed, which is easy to not pass, and goes to the court, and courts turn down, the first one would be down, the second one become a law. They have part of that bill, combination of both, but it's so, and has a good chance to pass because the choice, you have to irrevocably give up your health care, and you cannot go back to it. And so this is the bill number 1 of 2 parts. One health, it's Part B, so-called healthcare or COLA. Part A, lower COLA, only based on 25,000 of your salary, 2% more by current employees. So,
and COLA is the cost of living adjustment.
that's right. Yes.
Now, yeah, is this a problem that
What has happened is every 6 months there's a proposal to change the pension system. And the proposals are getting worse all of the time. The original proposals involved a choice between a COLA and health insurance, the state payment to health insurance, which is very important to you if you qualified for health insurance before the state actually paid for Medicare. Current employees are now more likely to be Medicare qualified, which makes the health insurance a little less important. But the COLA was a COLA based on your whole pension. Now what they're doing is restricting the COLA to just the first $25,000 of your pension, which means that if there's any inflation, the rest of your pension is going to be eroded, and you are going to be living on an extremely modest amount of money.
I assume everyone knows that we don't have Social Security.
Right.
We won't have Medicare Part B when we retire. That pays 80%. So when we retire, we have to have entirely health care because we don't have. So not paying Social Security, not only we don't have health care in when we need it the most. And life expectancy for man is now 77, for women is 85, just about as many. So it's become so critical that a contract, obligation, a law, which was obeyed, and is possible today, is not the problem, the pension, is the problem, lack of revenue by the states.
Now, is this a problem that will be lessened if the economy recovers robustly, or is this a problem that's going to be here no matter what?
It could be both. I mean, again, as you said, if they keep kicking the can down the road and having the economy approved, but then there's just nothing but proposals that don't get done.
Right.
I don't think that will happen, though. I think as we talk about the democracy element of it, fundamental to that is trust, and that is, eroding fast, and the pressure will be on the legislature so much that they'll have to respond, I think.
Yeah.
And instead of a proposal, actually pass something.
A robust economic recovery would help. There's no question about that. However, Illinois has not been in the last several decades at the growth end of the economy. Okay, so you have that problem. You also have changes in the economy where you have an increasingly service-oriented economy, and the state does not have a tax on services. It has a tax on the sale of goods. One of the suggestions that no one wants to approve, but one of the suggestions is to set up a general services tax. I don't know that it's the most comfortable suggestion, but it is one of them. There are some other things that can be done in terms of retirement income as well.
Well, okay, so we have the pension problem that is being talked about, but the other issues are not being talked about. The revenue side, what these bills would do to 40,000 of 100. What was the number?
We have 42,000 retirees and 72,000 working.
So over
their
100,000
contribution pays our pension. Their contribution, and the state said that's a great deal. We pay the pension. We don't have to contribute to the pension.
So you have over 100,000 people, highly educated, highly involved people that may be the losers if the proposal proceeds as is. What, in any solution, it seems like somebody's going to suffer from either lost income, lost services, or decaying infrastructure statewide. Who is positioned to be, how can we spread the pain around everybody?
There are some things that can be done. One of them would be to tax retirement income. This state does not tax retirement income. It would have at least the benefit of being based somewhat on income. And not all state retirees are well-to-do.
Right.
Some are fairly well-to-do, some are fairly modestly paid. The arguments about taxing income usually boil down to people would relocate. I am not that certain that somebody who has a house paid for is going to relocate because of state taxes. I think they relocate because they like warm weather. They relocate because they like mountains. They relocate to where their children are if they can afford to relocate there. That would be one way of raising additional revenue. At some point, you can extend the state income tax, not at the current level because there's no political support for that, but it is scheduled to step down, and you might stop at one of those steps.
Like the Bush-era tax cuts, just do not let it step back down.
Yeah, but it's not. But it's going to step down. It's going to take its first step down. There's no. Quinn evidently made some inquiries, and there was no support whatever for keeping it at 5%.
So any solution is going to have to be bipartisan, even though the Democrats are in control of the the two houses in the governorship. But there are, how do we come to an agreement that's fair?
And also, since Illinois is the only one, the only one has this pension problem. All the states have pension, more or less the same as Illinois. Illinois has the same. Illinois could ask the other state how they managed it. Well, they have all those solutions. 49 other states.
Shane, you were going to say something.
Well, yeah, we were talking earlier that California just recently went through this, and they had a long, hard, tough battle and a tough solution. And from the employee, the state, and the employer, they all have to pitch in, and some way, the promise has already been broken. And like you said, a fair way, an equitable way to do this. Everybody's got to contribute or get some. And I think with the taxes, that's a solution, but also in combination of extending the payment schedule. And so, but the fundamental thing is that still there. They have to do it, even because this is already a law. If they pass a law, they have to follow it, and we have to make sure that they do. We are under that obligation as well, I believe.
At some point, the unions representing teachers and state workers are going to have to come to a bargaining table, and they're going to have to agree on some concessions in return for some tax increases and some form of promise to repay. Right now, they don't want to do that because their constitutional and legal argument is we have a contract and you can't change the contract because it violates the state constitution. I understand the political problem that they have, but I think if you can't resolve the financial problems, at some point it's becoming very damaging. At some point, somebody's going to have to compromise. At some point, the legislative leaders are going to have to compromise with organized labor. And they have very, very large egos, and it's very hard to get them to compromise.
Of the revenue enhancements, to borrow the phrase, what is most likely to be palatable? And I mean, we can have another lottery. What the heck? That solved the school problem, didn't it?
No. Lotteries, half of the money raised in lotteries goes to run and operate them. They're minimal.
I wasn't thinking that as a legitimate plan.
Graduated income tax.
Graduated income tax.
That's right.
Services tax.
You taxing retirement you wouldn't have to amend the Constitution. A general services tax, you wouldn't have to amend the Constitution. Graduated income tax, you'd have to amend the Constitution.
So you're coming down to a constitutional battle no matter what.
It's easier to not amend the Constitution.
And like Dr. Baharlou had mentioned before, there's two things they have to do: pass it, and then make sure it's constitutional. So there may be a legal battle. There probably will be no matter what.
There'll be a legal battle no matter what, right?
It's going to have to. It's a chicken and egg thing. How do you make sure something's constitutional, and then if it's going to be challenged anyway, probably by some group that's unhappy. So it's going to take time too.
So what is the most likely path that we will see in the next 6 months? Put on your.
I think Fullerton Part B health care or COLA. Doesn't violate the Constitution. And many people who have Medicare A and B, they will give up their health care. And so that's one possibility, because it doesn't violate the Constitution and saves. Already, by the way, they have passed a bill. There's no more premium-free health care. SB 1313, CMS is going to send us all a bill and gradually going to increase it. So,
Dr. McNitt?
I think you may deadlock again. I think you're going to see, when you eventually do something to state employees and teachers and university employees, you're going to see political consequences. I do not expect Governor Quinn to even be renominated. And I don't know that the Republican Party is going to come up with anybody who is going to be any more attractive.
Well, this is a topic we could talk all afternoon, and we still might. Unfortunately, we've run out of time.
Thanks,
Dr.
Bob.
Ellen Baharlou
Thank you.
from the Economic Department, Dr. Alan McNitt, Andrew McNitt of the Political Science Department, and Shane Rogers of Lakeland College. Thank you very much for joining us.
Okay.